One night, when I was having my dinner, I received a call from emergency. This was a distress call. We had a patient, morbidly obese, multiple comorbidities, presenting with acute onset shortness of breath. The duty doctor told me on call that patient requires high flow oxygen at a rate of 15 liters per minute. He was hemodynamically unstable. With that call, I immediately rushed to the emergency without a second thought. On reaching emergency, I found the patient was in severe respiratory distress with elevated CO2 levels and metabolic acidosis because of septicemia and septic shock. I found that patient is a known case of pure red cell aplasia with uncontrolled diabetes, morbidly obese. Patient was immediately shifted to medical ICU on NIV support. The whole critical care team was mobilized. Patient was a resident of nearby society, had only his wife and a 3-year-old daughter as an attendant available in the city. There was no one else. The wife, the family seemed depressed. With the looming risk of ventilator support and worsening pneumonia, patient family was supported. Patient family was comforted and was asked to relax. We told them that we are available for them 24/7. With all that support and all in necessary investigations and line of management, patient was gradually treated better and better. He went better and better.
Hi, my name is Arijit Mukherjee. I was admitted into the Heritage Hospital on the 22nd night. We thought the complaint was a very easy complaint, being cold, cough and fever. मेरे को बहुत ज़्यादा सांस लेने में प्रॉब्लम हो रहा था और my wife had to admit me into the hospital. I got admitted here. ICU में मेरे को admit किया गया. जितना मेरे को याद है मेरे को wheelchair पे लाया गया hospital में and when I was admitted into the ICU, I was not sure if my wife was taking the right decision क्योंकि घर पे और कोई बड़ा है नहीं. She was the only one and the only thing she could do was admit me here because I have a daughter 3 years old and my mother is on wheelchair. My father has expired recently. So मैं sure नहीं था कि whether she's taking the right decision or not. I am also an earlier patient of PRCA, pure red cell aplasia, which the body does not produce enough red blood cells. So मैं जब ICU में था और मेरे को जो दूसरे वाले वेंटिलेटर पे बड़े वाले वेंटिलेटर पे डाला था तो आई वाज नॉट श्योर कि इफ दैट वाज द राइट थिंग टू डू एंड दे वर ट्राइंग टू पुट द मास्क ऑन माय माउथ एंड आई वाज टोटली रिजेक्टिंग इट एंड देन माय ब्रदर इन लॉ ही केम and he told that you have to take this as acute pneumonia and your lungs are full of carbon. The earlier experiences of hospitals around have not been good. Then things started getting better. Spoke to the doctors next day so I could understand what was happening inside. So the next day was the first time that I met Dr. Utkarsh and he said that कि अगर मैं उस वक्त वो नहीं लेता वेंटिलेटर तो they would have cut my throat and put a pipe inside and they would have paralyzed my body to put me on the ventilator. मैंने उत्कर्ष से एक ही चीज़ पूछी. मैं सर मैंने तो आज तक यही सुना है कि वेंटिलेटर से कोई वापस नहीं जाता है घर and it was a big fear to me. Then things happened. Slowly recover किया. ICU में बहुत अच्छा केयर लिया गया. I could not believe that this hospital being so new in here in Noida would be so effective for my treatment. Dr. Utkarsh knew about PRCA. He knew how to handle it. The best thing is that there are many people who will be around, will be there to help, especially the nursing staff. The extended care post ICU was very good. मैं थोड़ा सा worried हो रहा था क्योंकि घर कैसे चलेगा and how things would be and expenses and everything. But Dr. Utkarsh was very careful enough कि वो ये समझे and he said that he was kind enough to let me work from here and bring my setup in here and work from here while taking care of me. So I'm grateful that they did that. So I'm very thankful to Heritage Hospital, which I would have never believed if it was otherwise कि एक अच्छा hospital है until I experienced it. I'm shifting back to my hometown next month, but I wish this hospital was there 8 years back. तो शायद मेरे को कहीं और hospitals में नहीं भटकना पड़ता नोएडा में. Thank you.